Okay, I'm starting your timer, and here is the question. Right, if you have read and understood, kindly begin your explanation.
Okay, after entering the room, I'll wash my hands and introduce myself to the patient and confirm the age and the name of the patient. And then I'll take the permission from the patient to examine his breast. That would include looking at the breast, placing a hand on the breast and to feel and assess the breast tissue and examine the glands of the armpit and neck. I'll request the patient to take off his gown and I'll ask him to sit upright on the bed, side of the bed, keeping his arms by the side with the hands relaxed on his thighs. And
Yes.
then I'll start by taking a close look to the breast for the scars, asymmetry, or any mass. If there is any mass present, I'll see for the size or position and overlying skin changes, any erythema, any puckering or PUD orange changes, or I'll see any nipple changes like retraction, any scales or any discharge. I'll then request the patient to put his hands on hips and push it inwards so that the pectoralis major will be changed, and repeat the same inspection again. If any mass will be present, I'll see if it is tethered and move with pectoralis major or not. Then I'll request the patient to put his arms above the head, placing both the hands behind the head, and then I'll inspect the breast tissue for any evidence of mass, any asymmetry, any presence of dimpling or puckering. I'll then ask the patient to lean forward, keeping the hands behind the head, and I'll repeat the inspection of any and see if any dimpling or puckering is exacerbated in this position or not. After that, I'll ask the patient to lie down on the bed at 45-degree angle, and I'll ask if he has any pain at the moment as I'm going to feel the breast. Then I'll examine the uh, breast first by asking him to put his hand first. I'll any right or left first. I'll ask to put his right hand behind the head. Usually we'll do asymptomatic breast first, and then I'll use my flat fingers and I'll compress the breast tissue against the chest wall, feeling for any mass. I'll do it in a clock face method or a spiral method. In clock face method, I'll examine the breast tissue each hour of the breast, and in a spiral method, I'll start at the nipple and working outwards in a concentric circular fashion. Uh, if there will be any mass present, I'll look for the size, borders of the mass, its consistency, if any fluctuations present or not, and if it is fixed to underlying tissue or skin. Then I'll feel the axillary tail of the breast tissue. After that, I'll ask the patient to squeeze the nipple to see the presence of any discharge there or not. And after that, I'll do the lymph node palpation. For that, I'll ask the patient to sit at the edge of the bed facing to me, and I'll palpate the lymph nodes for and their size, consistency, and fixity. For right-sided axillary lymph nodes, I'll support the patient's right arm with my right forearm, and by using the free left hand, I'll feel for the medial and lateral, anterior and posterior, and apical group of lymph nodes. I'll also do the same lymph node examination on the left side also. After that, I also feel supraclavicular, infraclavicular, parasternal, as well as cervical lymph nodes. And I'll do all the examination bilaterally. After finishing the examination, I'll thank the patient, help him to put on the gown, and ask him if he needs any help. Then I'll wash my hands. To complete my examination, I would like to do visual field examination to rule out any presence of hyperprolactinemia. I will check the thyroid status of the patient to see if there is presence of any hypothyroidism. I'll also do the chest examination to rule out this bronchial carcinoma. I'll do the abdominal examination to see any presence of liver enlargement in case of liver cirrhosis, and also see the sign of renal failure. I'll do the external genitalia examination to rule out the hypogonadism, and testicular examination to rule out presence of any testicular tumors. Today, I have examined a 54-year-old gentleman who presented with bilaterally breast enlargement. On examination, there is bilateral symmetrical breast enlargement, but there is no scars or masses or any nipple discharge. There is no retraction. There is tender, palpable tender present disc under the areola on the both sides, but there is no axillary tail no axillary tail pathology, and the axillary lymph nodes and other lymph nodes are free from any pathology. So my differential diagnosis is this 50-year-old male having bilateral gynecomastia.
Okay. Can you please tell me what are the what might be the causes of bilateral gynecomastia?
To start with, this may be due to the liver affection like liver cirrhosis, as patient is a case of alcoholism, is taking alcohol, and other causes may be the bronchial carcinoma in the lung. There may be pituitary tumors like prolactinoma. In thyroid, there will be hypothyroidism, or in case of renal failure, it can occur, or in case of others like hypogonadism or testicular tumors. There are certain drugs like spironolactone or ketoconazole, ranitidine, or antipsychotics also can cause gynecomastia. And in case of elderly people, it can be a physiological gynecomastia.
Good. So what are the important laboratory investigations that you'll focus for this patient, or you'll consider?
For this patient, I'll first start with liver function tests and renal function tests to rule out the for evaluate the renal disease or liver disease and renal disease. I also go for see the testosterone level as well as the luteinizing hormone level, estrogen level, and also the metabolites of testosterone, dihydroepiandrosterone level to evaluate the patients if there is any is a related syndrome, or I'll go for thyroid function test to look for the TSH and T3, T4 level to see if there is any thyroid pathology. I also do the serum prolactin level if suspected pituitary tumors, and I'll go for testicular tumor markers if I suspect any testicular tumors. Other than that, I'll go for imaging studies. For that, first I'll advise the mammogram for if I'll suspect any carcinoma breast, and if there will be any mass, I'll go for the fine needle aspiration cytology or biopsy. I also advise for abdominal ultrasound for the liver pathology, and testicular ultrasound also will be done. And we'll do the CT chest or chest X-ray to rule out any malignancy.
Good. What should be the management for this patient that you can offer?
The management of this patient will depend upon the underlying cause.
Very good.
First, and then the surgical treatment of the local pathology will be the reduction. First, there will be treatment of underlying cause, followed by the surgical reduction, mammoplasty, or mastectomy.
Very good.
Which will include the preservation of areola and nipple.
Yes, very good. Good. Yes. Yes. Yes, for male as well.
Thank you, ma'am. Yeah.
And even the fine needle aspiration biopsy as well. That
Yes,
can also
yes,
be.
ma'am.
Ultrasound is of testicular region. It is not of the lump. Very good, excellent. I was asking a question. Right. If you have read and understood, kindly tell me how the shoulder girdle is formed. What is shoulder girdle? Shoulder girdle. Yes. Can't even say the word. Can you please tell me how is it formed? Yes. Dr. Mohammed, how is shoulder joint formed? Can you identify or can you name the bones which form shoulder joint?
I think the network, ma'am.
You must be.
Yeah, I think network.
Yes, Dr. Mohammed, how is the shoulder joint formed?
Hello.
Yes, how is the shoulder girdle formed? What are the bones which form shoulder joint?
His network is too much.
Yeah,
Your voice is interrupted.
yes, it's your network. I asked you, what are the bones which form the shoulder joint? What are the muscles which contribute to form rotator cuff? Yes.
The subscapularis and the teres minus muscle.
Yes. Can you tell me which muscle is supplied by which nerve? Can you identify this number 2 over here? What that is? Number 2.
Okay, the subscapularis is supplied by the upper and the lower suprascapular nerve, and the
Yes.
supraspinatus and the infraspinatus is the suprascapular nerve,
Yes.
and the teres minus is supplied by the axillary nerve.
Yes. Can you identify number 2 here in picture
It
A?
is the acromion.
Okay. And number 15 over here? 15. Supraspinous fossa. And then number 5.
Infraspinous.
Yes. And then 11 over here.
Subscapular fossa, I guess.
Yes.
This is
Okay.
the subscapularis fossa.
Fossa, good. Okay, can you please tell me which joint is here and which bones take part in the formation of that joint?
It is the ball and socket synovial joint.
Yes.
It is formed from the acromion and the head of the humerus with the acromial head of the clavicle.
Okay, very good. Okay. Can you tell me what kind of joint is shoulder joint?
It is synovial joint, atypical synovial joint,
Can
and
you
ball and socket.
identify this image, please? And identify the structures. What is number 1?
Okay, this is the coronal of.
Number 1 is acromion.
It
Okay.
is coronal
Number 2. Yes.
arthrogram. Okay.
Yes.
2, this is the axillary nerve with the circumflex artery.
Yes.
And 3, this is the axillary cyst of the joint. And 4, this is the clavicle. And 5 is the deltoid muscle. And 6, the glenoid labrum, glenoid cavity. And 7, the glenoid labrum. And 8, this is the head of the humerus. 9, this is supraspinous. And 10, this is the supraspinous ligament.
Supraspinous tendon. Okay. All right. Good. Can you tell me what are the structures which are attached to coracoid process?
Sorry.
What are the structures which are attached to coracoid process?
Okay, there is the 3 muscle and 3 ligament.
Yes.
The 3 ligaments, the coracoclavicular and the coracohumeral and the coracoacromial ligament. The muscle, and there is the coracobrachialis muscle
Yes.
and the
Short head
teres
of
minor
biceps
muscle
and pectoralis
and the
minor.
short head of the bicep.
Yes.
Okay.
All right. Can you please also tell me what are the spaces which are found near the shoulder joint? Can you tell me how these are formed?
Okay, there is a quadrangular space
Yes.
and there is a
Triangular.
uh, triangular space and triangular
Yes.
interval.
Yes. Can you tell me what are their boundaries and what are their contents, please?
Okay, the quadrangular space, the superior border is the teres minor and the inferior is the teres major, and there is laterally the humerus, and medially there is the lateral head of the long head of the triceps. It includes the axillary nerve and the posterior circumflex humeral artery. The triangular space, superiorly there is the teres minor and inferiorly there is the teres major, and laterally there is the long head of the triceps. It includes the circumflex scapular artery, and also there is the triangular interval.
Yes.
Mid triceps, and superiorly there is the teres major, and laterally there is the humerus. It includes the radial nerve
Yes.
and the profunda brachial vessel.
Can you tell me what are the muscles which are inserted in bicipital groove? What are the muscles which are inserted in bicipital groove? 2 majors, 1 dorsi. Yes. Okay. Can you tell me what are the factors which stabilizes the shoulder joint? Oh, got disconnected again.